What's the biggest misconception physicians have about these issues, payer contract complexities, and the client reimbursements?
It could be a misconception or just the narrative in which has been put in place of a lot of these practices that there's nothing you can do with your contracts with payers. We've seen that firsthand in our organization in doing negotiations on behalf of practices, is that there's a lot hidden.
That mindset to make it a priority for these independent practices to go after, what's owed to them. I agree. I think that's something that you have to break through. Hello, everyone. Welcome once again to Medical Practice Success Secrets Podcast. I'm your host, Theo Harvey, CEO of SensorMed, and I'm super excited about my guest today, Brett Spark. Brett, how are you doing today?
I'm doing great. Thanks for having me.
Awesome. Well, if you don't know Brett, he is doing amazing work as the CEO of Aroris. This is a company that really focuses on helping independent practices with their contract negotiations with payers. Brett has a robust background in healthcare management. Brett has honed his expertise in business aspects of healthcare, starting from operational roles in a large regional health system to executive leadership positions in private practice groups. Brett's primary mission is to empower healthcare providers with the autonomy to deliver patient and team-centric care by equipping them with strategic resources to adaptively manage the intricacies of payer contracts, which we all know can be a bear. He is an avid speaker on topics pivotal to healthcare business success, including payer contract optimization, business development strategies, leadership, organizational culture enhancement, and in the forefront of healthcare innovation. This is an interesting time to kind of talk about this because according to the American Medical Association, in 2024, only 42% of physicians worked in private practices, which were owned by themselves. This is a sharp drop from about 60% back in 2012. This is 80,000 physicians who, just left private practice. I mean, in your opinion, what is really causing this? And what's the root of this?
Yeah, it's a good question. In my perspective, it's a concerning trend that we hope will kind of take a pivot in the other direction. But if you boil it down, I think there's no other or larger concern than the relationship that practices have with payers. And I think what exactly is the root cause of that could be a number of different things, but reimbursement trends, in my perspective, would be a number one way or a number one reason why practices are seeing less and less physicians that are entertaining that. And I think there's a concern with physicians as you're coming out of med school, as you're coming out of residency, that what's the risk tolerance for getting into a private practice lane? And when you see some of these trends going in the wrong way, from a reimbursement perspective, a lot of them are now choosing to go the employment route, which is sad because I think there's a lot of value that can be had beyond just the medical care and quality of care. But also physicians having that autonomous way of practicing, I think leads to innovation. It leads to a new way of doing things. And that's disappointing that we will have less of that in the private practice space.
Yeah, totally agree. I mean, we can tell I'm a little bit older with some of the gray hair showing here. And so I remember a time where, being a physician was basically you're going to be an entrepreneur. You're going to just put up your
Yep.
shingle and treat the group and the family in the area wherever you lived. And I work with a lot of rural providers and, they're kind of like the last bastion of folks that kind of delivering care. But as they start to get gobbled up by private equity or large healthcare hospital organizations, we're seeing access decline in certain these areas. And so it's definitely disheartening to see that drop. And maybe there'll be a trend the other way, and we'll talk about later about innovation and technology with AI and how that can empower physicians to do more with less. The big struggle, as we all know, is just reimbursements when it comes to CMS and just commercial payers. And we kind of do some billing for some of our practices as well. So we understand the challenges that comes with that. When you kind of think about payer contract complexities and the client reimbursements, and how they're affecting independent practices. What's the biggest misconception physicians have about these issues? And how would you advise practice leaders to stay ahead of regulatory and these payment changes?
Yeah, so I think it could be a misconception or just the narrative in which has been put in place of a lot of these practices that there's nothing you can do with your contracts with payers. The narrative has been historically that whatever the payer puts in front of you, that's what you get. You take your reimbursement rates, you take your contract setups and the complexities that go along with that with payers, and you do as much as you can and you try and find value in other areas by adding slots for patients working weekends, working evenings, and that's how you grow revenue. And I think that's a massive misconception. And we've seen that firsthand in our organization and doing negotiations on behalf of practices is that there's a lot hidden. The complexities are real. Payers have set up their arrangements with medical practices, large and small, to be as complex as possible because there's value in that from a payer perspective. And I think what we've learned is that if you take the time and you put the resources in place to break down those relationships on an individual per payer basis, you will find opportunities. And it might be in true blue-blooded negotiation, back and forth negotiation with payers along rates, or it might be in some of the complexities that exist as far as site of service differential, credential level, reimbursement terms. There's a lot that's hidden in the language that can lead to value for practices that they don't get to that because you might have 15 or 20 in-network payers and it's hard to manage that's a full-time job. And so if you're not digging into those terms and conditions, you're going to miss some of the opportunities that are there. But that's kind of the misconception we've tried to break down, is that you do have the ability to have a conversation with the payers. Everybody's not on a standard fee schedule that you can't change, which we hear every single day, that this is standard, this is what we put out there, and that's a pretty common response. But a lot of it is breaking through some of those narratives that exist, that it's just take it or leave it.
Gotcha. That mindset to make it a priority for these independent practices to go after, what's owed to them. I agree. I think that's something that you have to break through when they're so busy and they don't have very limited time to kind of go, through that process and may think it's overwhelming. So definitely a service like this is extremely helpful to kind of help practices navigate that. We try to keep it very practical here. So, and I have one, and I want to run it by you as well. But, can you talk about like just, one simple strategy or negotiation tack you feel that has delivered the most impact for a practice client, and why do you think it worked?
Yeah, I think there's a number of them, and I think the biggest thing that we've learned in our organization, and I guess what we've seen going into it, is the biggest concern from practice leaders is data and time. They don't have a lot of data going into these conversations, and they don't have a lot of time because they're running a business on top of needing to take care of these relationships. And so I think what we've been able to decipher with newly available information, such as transparency data, different benchmarks that exist now that didn't always exist from a practice opportunity, I think those are the biggest areas that we've seen kind of move the needle, so to speak, for practices. So before you reach out to a payer, before you get involved in a negotiation with a payer, make sure you're starting right to end right with that type of narrative, and using what's available to you now from a public perspective. So if you want to dig into transparency information, what are competitors getting paid? Or if you have some geographic areas that you think would be valuable information, do that before you go into the conversation with payers. And then also take the time to benchmark yourself. Understand which parts of the agreement are important to you. Where is your volume coming from? What's important to you? Are you shifting some stuff from in the hospital to an ASC setting or to an outpatient setting? Make sure you understand all of those terms going into it. But I think benchmarking and available data are the biggest things that have led to better outcomes for our services now. And that's a strategy that can be applied across the board. There's a lot of unique areas within individual practices that are more valuable than others, but the data availability is in a great position as long as you take advantage of it.
Mm-hmm. Yeah, that was exactly where I was going with it. Just comparing benchmarks to geographic, area, and looking at what other payers are providers in the area are getting paid, and comparing that. That is some great data, right? And it's readily available in some public areas as well. And so, to your point, going through that and finding where the data is located, that's why individuals, you need help with that, some of that, because it's not as easy to accessible, or at least in parsing it. And I'm sure you and your team have all kind of workflows and processes to kind of parse through that data set. But I agree, and you'll be surprised. It's like I just remember the story. When I first started working in corporate America, no one said, "Don't tell your salary, right? Don't tell your salary." And that's the worst thing you should do, right? When it comes to negotiation, because the more information that you know about what is being paid out, the better position you have in a negotiation conversation. And so it seems like very similar tactic there.
Yeah, it's absolutely true.
So when you kind of think about your previous role, in a larger healthcare system and kind of managing that process, think about like, the lessons learned and how you kind of navigated, these behemoth systems. What are some, practical advice that you learned that you have started to see that private practices can adopt to their operations to be more efficient and take advantage of some of the things that are out there?
Yeah, I think one of the big things that I've taken from working with a large corporate environment or regional health system into the private practice space is kind of the process and standardization of what you should be doing with these agreements. And pulling that into the private practice space as well. You need to have a plan. And as much as I don't love red tape and how slow some of our health system or corporate environments can move, I think there is a standard approach that you need to have when you're looking at these individual payer agreements to make sure you're setting yourself up for success on the other end. And that's something that private practices can pull in as well. What's your checklist of items that you're going through before you ever have a conversation with the payer to make sure you have the answers to those questions or you understand the dynamics that exist within the agreements that you have. And that process can be applied to every payer. You go through that checklist for every payer that you have, and you make sure that you have those things in place before you're reaching out. That's one of the things that we had with the health system that I was at, and something that I applied in the private practice space as well.
Have you read that book, the Checklist Manifesto?
I have not. No,
Yeah.
that sounds perfect.
Yeah, Tol Gawande. He is a medical doctor, and he wrote this comprehensive list of like how to think through and create checklists and or organizing your life. But he came from the healthcare system, and so he understands very well that doctors and other healthcare professionals love checklists. And so he wrote that I think back in 2009. So I agree. Having some systems and checklists. That's I came from a large organization as well, Cisco Systems, and understanding the processes and bringing that kind of innovation. How do you innovate and create a process around innovation is so key. And so, and having a checklist was a big part of that, right? Understanding what the roadmap is, but what are the goals toward that roadmap, really important. So you hit the nail on the head with that checklist process. We talked about a little bit of innovation, technology, obviously, payer contract negotiation, innovation with data, right? But there are new tools coming out. Our company deals in remote patient monitoring. There's tools around artificial intelligence, with remote scribes. What role do you see these tech-driven solutions enabling private practice to compete and thrive in this changing marketplace?
Yeah, I think that there's a number of different ways to apply the question. I think on the care delivery side of private practices, the tech that's coming in, the innovation that's coming into the environment is going to expand the reach of even our private practice lanes. So we can do more because of the tech that's available. Remote patient monitoring is a big one, as you brought that up. There's availability for the quality and subspecialized services that are not readily available everywhere to be applied in other geographic areas because of that reach that can be applied in other areas. And so I think the care delivery side, it's exciting. I think private practices will be able to expand, will be able to grow in markets and areas that they didn't historically have the ability to grow into. And I think that's great. On the kind of payer provider side of things, or the back of the house side of things, I think the tech will allow organizations to do more with less, to be more in tune with what's hidden in some of these terms and conditions. I've mentioned that several times, that there's a lot hidden in just the language of these agreements. Well, if my outcome is telling every practice that they should read these 60-page agreements for each payer and do it 15 times or 20 times, that's not going to happen. We all know that's going to happen. But if we have resources available that are low cost, that can pull out the details that these practices need and can read those and help you navigate through those complexities, I think that will allow our practices to be more informed going into some of these conversations. So I think on both ends of the spectrum, there's exciting things coming on the care delivery side. And on the back of the house, how you're running your business, I think there's ways that you will be able to do more with low cost tech resources that are coming into the market.
Yeah, agreed. I mean, healthcare is so regulatory, right? We often sign BAAs, business associate agreements, HIPAA. You need to stay away from stock law violations. Obviously, in contract negotiations, especially if you're doing managed service agreements, all that is a lot. And then having data and tools to kind of help you parse that information a little quickly, and really, a lot of that language, from a legal standpoint. I'm not a lawyer by training. I don't know if you are, but
No,
a lot.
and I don't claim to. Yeah.
Exactly. I was looking through a contract this weekend. I was like, oh my goodness. So
Yeah.
it's all the little, like you said, the little things that get you because there's a reason they're in there. If nothing else, at least you're aware of it and what and it may not be important for you right now, right? But understanding that, and you're right, you're spot on with that. Technology can help you kind of parse that a little bit easier, even if you're not a lawyer, and maybe save a little bit on your legal bill. So when
Right.
when you put that
Yeah.
information out. So no, that's great. Wow, Brett, this is interesting. Tell us a little bit more what you're up to now, and what are some of the things that you are advising private practices with your current company.
Yeah. So with Aroris, we focus solely on the payer provider relationship, and specifically in the reimbursement lane. There's so much when you look at the RCM space. There's so much happening with denials, prior authorization, really post visit. And there's a lot of resources that are coming into market, a lot of innovation that's coming in via AI and some of these new technologies, which is wonderful. We started our business to think more on the front end of that relationship. So, what are you doing once you've signed this agreement to understand the terms and conditions of that agreement and make sure those are reviewed on an annual basis? The one thing that we do know is that reimbursement's not stagnant. It's going to change, both at a government level and a commercial level. It's inevitable. It's going to change. What we didn't see a lot of were resources for organizations to support and understand that change and be able to navigate that on behalf of practices. So our organization is really tech driven. We have a platform that digitizes those contracts between medical practices and the payer and pulls out all that detail and aligns it with your medical practice so that based on what's important to us, what are our contracts and terms with every single payer that we've signed these agreements with. And then it allows them to take that information and our team will go out and negotiate on their behalf if they need those services on top of the tech solution that we brought into the market. So we're trying to be nimble with the digital platform that didn't exist beforehand, but we're rooted in services and saying that somebody needs to have these conversations with the payers. And in a lot of cases, the practice isn't set up to have the resources to do that. So if they need that, our organization can help navigate that for them.
Absolutely. I think everyone thought technology was just going to replace, the human to human communication. But in healthcare, I think that never goes away, and services will always a big part of it, from provider to patient to provider to provider and to vendor to provider, and then contract negotiations with payers. So I think those are the data can only get you so far, but then it has to
Yep.
have that human touch and the nuance that's going to be required in order to kind of navigate these complex scenarios when it comes to human healthcare. So I think you're spot on with that, and I agree. We have a tech-enabled solution as well, but always comes
Yep.
back to that nurse and that patient having a conversation, no matter how
Yep.
much data or how much information we're getting from wearables and other type of technology. And so I think that is totally spot on, and super excited about where the future goes. We started, right around the COVID, our processes, and that was a big explosion of healthcare innovation, right? Because remote care and clinical delivery had to change because no one could come into the office. But now we're seeing change now because of the technology, right? And with the automation and AI tools, we're seeing a lot more energy around that, and people creating like AI open EMRs in order to kind of provide help for private practices looking to do a little bit more with less. And so, and also, what you're doing there is great with helping them. I mean, it's hard to invest in new technology innovation if you don't have the money. And so, maybe going back and figuring out how you can, source additional revenue where you probably weren't getting your fair share. And I think that's super important for private practices.
Yeah, it's a big part of what we do. It's a big part of what we believe in as well. I think high quality care is being done in the private practice arena, and if we can support continuing that growth, that's fantastic. We will always have a service component to our business, to your point, that we're not going to replace the person that's going out and having those complex conversations with the payers to understand the member needs, to understand the payer needs, and really support what the practice is doing. But if we can allow some tech to help enable those conversations and make them a lot cleaner and a lot more specific to what the needs of that practice are, we'll absolutely take advantage of that. But it's exciting times for where the growth can happen.
Absolutely. Well, Brett, where can people find you, reach out to you if they have questions about you or your company?
Yeah, so you can find us on LinkedIn under Aroris Health on LinkedIn, or visit our website, aurorishealth.com, and reach out via there. And we'd love to have a conversation around where your practice is at, what your needs are, and how we might be able to support.
Absolutely. Well, everyone, listen to what Brett is talking about here as you kind of think about, especially as we plan for next year, what do you want to do with your practice, deliver new value by, looking at where your contracts are now. This is the future, and you need to invest for the future with new ways of thinking. So this is where we're all at. So hopefully you enjoyed this podcast, and definitely join us next time as we talk about the new normal in healthcare.